Welcome back to my patient empowerment series. My name is Dr. O, and I'm a family physician, public health specialist, and medical educator. In this video, we're going to talk about self-advocacy so you can get the care that you need. Okay, so as a medical educator, I have some good news, which is that medical students today are learning how to be really good listeners and to use a patient-centered approach. The bad news is that most of us who are in practice now didn't get that lesson. There's, a good body of research that shows that patients get interrupted by their doctors. In fact, studies show that doctors tend to interrupt patients within the first 11 seconds of speaking. And this doesn't even account for the disproportionate way that people from historically marginalized groups like Indigenous and Black communities are treated when they voice their concerns in healthcare. Now, I'm part of a much larger movement in healthcare to change this and provide much more dignified care to patients. But in the meantime, it is really important for you to learn about self-advocacy so you can have the care that you deserve. And yes, self-advocacy has been shown to lead to better health outcomes. So when you have to visit your healthcare provider, take a moment to think about what's on your mind. Are you worried about what you're going to hear when you're there? What are your medical concerns? Are you worried that you're going to be judged or stereotyped or dismissed, or maybe that your concerns will be ignored? It's important to think about all of these things in advance, and ultimately, the best thing that you can do is be intentional and be prepared. Before your appointment, take some time to better understand your concerns. It actually is a good idea to look up your concerns online from a trusted resource. So using a symptom checker like the one that's available from Alberta Health Services or the Mayo Clinic or WebMD can help you narrow down and have a better sense of what you are concerned about. Now keep in mind, those resources are not there to diagnose you, but it's going to help you have a better idea of what you're going through and what you're concerned about. The key here is to prioritize. So you want to write down your concerns and have an idea of, what your main priorities are. You can write your concerns down in order of priority, and then be ready to share that with your provider, keeping in mind that probably you're going to tackle one issue per visit. Now here's a bit of a healthcare hack. The reason why it's important to bring that list, even if you're not going to address all of those issues in one visit, is that it can help the healthcare provider sit down and understand your concerns, but also the healthcare provider might work with you to reorder that list. They might notice something on that list that has a greater impact on your health, and together you might actually decide to tackle that first. So once you have your list and you go over it with your healthcare provider, and then choose what the one issue is that you'll be tackling that day, the next thing that can be really helpful is for you to take some notes for yourself. So that will help you remember what was said and when your next appointment will be. Another thing is if you're feeling really unsure or anxious, then it can be helpful to bring someone with you. It can be helpful to bring a trusted friend or a family member with you. That way, this person is there to help you remember certain details and just to be a source of support. This is particularly important for serious conditions like cancer or chronic conditions like autoimmune diseases, where you're going to be seeing a lot of different specialists and have a lot of different appointments. Also, it can be really crucial to bring somebody with you if you have a condition or you're going through treatment that affects your memory. Having a second set of ears can be invaluable. Now let's talk about some powerful questions that you can ask. There's one really crucial question that you can ask if you're being diagnosed with a condition, and that is, could it be anything else? It sounds simple. It's a very simple question, but actually, because doctors, nurse practitioners, or any lead healthcare provider, we are trained to think about what's called a differential diagnosis. That means we have our main diagnosis, and then we usually have a couple of other things on our mind. Asking just very respectfully, could it be anything else, creates like a respectful space for exploring other things that the provider might have on their mind that you want to know about. Now, once you ask that question, could it be anything else? Then once the healthcare provider or the doctor gives you the answer to that question, you can follow up with, okay, how can we be sure that it isn't one of those things? And then that might be, okay, well, a lot of providers will say, well, let's start with this issue that I think it is, or let's focus here. But if that's not the case, then we will do X, Y, Z, and whatever the next steps might be. It might be referrals or other tests, but you've created the space to have that conversation and to have a more fulsome plan. Another set of important questions, particularly if you're being prescribed a medication, is to ask things like, how does this medication work? What are the side effects? What will happen if I don't take this medication? These types of questions can help you have a better understanding of the treatment plan that you are getting and for you to feel more comfortable following it. And remember, in Canada and in many other countries, if you're from a marginalized or minority group, you do have the right to ask for a provider who shares the same language with you or cultural background if you think that it's going to impact your care. This is specifically if you are from a minority group and you feel like the barriers that there might be linguistically or otherwise could pose a barrier to the quality care that you receive. So you do have, particularly in Canada, you do have the right to ask. By staying informed, communicating effectively, and being aware of the resources available to you, you can take control of your healthcare journey. The more you practice self-advocacy, the better equipped you'll be to be able to navigate the healthcare system. In the final part of the Patient Empowerment series, we will be talking about system awareness so that you know how best to understand the healthcare system and navigate to get the types of outcomes that you want. Thank you for watching. Please subscribe, and remember, you are your own best advocate when it comes to your health. You got this.